Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
Now, the financial strain the health service is under was highlighted again this week after a report by the Institute for Fiscal Studies and the Health Foundation argued health spending needed to rise by just over 3% to keep the NHS providing the same service it does now. So are the public ready for tax rises, and will the government have the stomach to act? Here's Elizabeth Glincoe.
The NHS this year has been under tremendous strain. All our staff have been pushed to the limit with all the patients coming through our doors, and something just has to change.
We're beginning to struggle to look after our patients. If we do not get increased funding in the near future, I cannot see general practice continuing in its current form.
We face a stark choice. If we want to continue with an NHS that delivers high quality care, free at the point of use, based on need and not ability to pay, then we are going to have to increase funding.
The calls for an increase in NHS funding have been growing louder.
With all the patients coming through our doors, something has to change.
Are you going to see one of the IAP ladies here?
Across the country, waiting times are up and appointments harder to get. Staff at this GP practice in rural Wiltshire say they're feeling the strain.
What we're finding is that we've got fewer and fewer doctors at the present time. We're really struggling with locum cover, so we often have to cover in-house. We're struggling to recruit practice nurses, the community teams, the district nursing teams are struggling to recruit. And that's partly because, I think mainly because, we're all finding the job incredibly stressful.
And would you say it is worse now than it was 10 years ago?
If I look back 10 years ago, I'm seeing way more patients in the day. And that makes the day very intense, very exhausting. We worry about making mistakes. We worry about not doing the best for our patients in that time.
250 miles north, on a hospital ward in West Yorkshire, consultant Nick Scriven tells a similar story.
Year on year, things are definitely getting tougher. This winter was worse than last winter. This May is worse than last May. It's just getting worse. We haven't got the nurses, we haven't got the beds. We know that we're running with bed occupancies in the high 90s, even 100%. If we had the money, we'd have more safely staffed, safely provisioned beds, and the pressure wouldn't be quite as bad.
Since the NHS was created almost 70 years ago, it's become an increasingly big chunk of government spending, from about 3% of national income in the 1950s to about 7% today. But despite that, with an ageing population and increasing demand, it's now under more pressure than ever.
With key performance targets now being missed, Health Secretary Jeremy Hunt has been pushing for a more ambitious settlement ahead of the NHS 70th anniversary in July. Meanwhile, Chancellor Philip Hammond has been pushing back.
Chancellor, how much more money should the NHS get? Are taxes going to have to rise?
Very nice to see you.
In an effort to influence that debate, a report backed by medics and NHS managers was published this week. It was co-written by Anita Charlesworth.
The last 8 years have been a period of unprecedentedly low funding growth for the health service, and the impact of that is that it's really struggling to meet the demands of an ageing population with more chronic disease.
So if we don't get the funding that your report is suggesting the NHS needs, what will be the result?
So the real risk there is that the NHS becomes just a service in crisis, dealing with people as emergencies, and some of the things that are so important to people's quality of life, getting your hip replaced so you can remain mobile, having your cataracts done so you can see, getting good hearing aids, that those sorts of services are the ones that will have to bear the strain.
In fact, the report says even to maintain the current levels of service, funding must rise.
With other government departments having borne the brunt of austerity for the last 8 years, if there is going to be extra money for the NHS, then it has to come from somewhere. And if it's not through borrowing, then it's got to be taxation.
It's a necessary evil, I guess. We're all living longer. You've got to contribute.
If it means we get a better service on the NHS, yeah, definitely. My granddad's just been in hospital, so what they've done for him is amazing.
We've had the NHS for 70 years. And it should remain as it is. If I had to pay more tax, then I would, but I don't think we should have to.
Some on the Conservative backbenches like the idea of tax rises even less.
Well, I think I speak for a majority of Conservative MPs. I think a big majority of Conservative MPs want to spend more on health, and I think a majority of MPs would be very worried about the idea of new taxes, however good the cause, given the large amount of money there is available one way or another.
And so as the Department of Health and the Treasury continue to cross swords ahead of the NHS anniversary, you might say the Prime Minister is stuck somewhere between a rock and an existential crisis.
Well, joining me now from Exeter is the Conservative MP and Chair of the Health Select Committee, Sarah Wollaston. And here in the studio, Sean Worth, who's a former Special Advisor to David Cameron. He was closely involved in the health reforms in that government. Welcome, both of you. Sarah Wollaston, can I ask you first, it seems there is general political agreement that the NHS will need more funding and in a sustained settlement that's not just year to year plugging the gaps. Yes. Do you have any understanding of where the government is leaning in terms of how to pay for it, whether it would be increased taxation, increased borrowing, whether there would be a special NHS tax?
I can't answer that question, but what I can say is the advice that I'd give to government is to take a whole system approach. Don't just look at the NHS, look at social care and also look at public health, the prevention arm of services, and look at the workforce and the transformation work that needs to be done. And absolutely, I agree with Anita Charlesworth that we need to see a sustained long-term plan, and that needs to be at least 4% a year in the long term if we're going to be able to improve services. And if the government decide to go for 3% a year, I'm afraid that's not going to even allow us to maintain the standstill position because of all the pressures that the NHS and social care face. So we have to be realistic with the public about the alternatives.
4% may be necessary, but it's a big chunk of spending. What would your preference be for how the government should find that money?
Well, I think the government should find the money through extra taxation. I think that the public would support that. We know that the public support earmarking or hypothecation of these taxes. It's not popular with the Treasury, but it is more popular with the public. It would have to be a soft earmarking because in lean years it would have to be topped up from elsewhere. But we know there are lots of models from around the world about how these things can be done, and we know the public very strongly support having an NHS that is sticking to its founding principles of being free at the point of delivery based on need and not ability to pay, and the public absolutely want to see services improved. So we need to be out there explaining what the options are. My Select Committee, along with the Communities and Local Government Select Committee, have been working with a Citizens' Assembly, which is like a very large citizens' jury, to listen to their views, and we'll be publishing our report shortly. But I think we need to be out there talking to the public about all the options, but doing nothing, I'm afraid, has very serious consequences.
Okay. Sean Worth, do you agree that at least 4% increase in spending is needed for the NHS?
I certainly saw the Institute for Fiscal Studies report last week, and they are, unlike any other bodies that have talked about NHS funding in the past, they are completely impartial. They're proper economists, and they are saying more than that, yeah, pretty much. So I don't think anybody disagrees with that. I think the problem that Sarah has and some of her colleagues will have is how the government responds to that, because I think within her party, on the backbench of the Conservative Party, there's a current live debate about this, about whether the government can realistically pop up in advance of this birthday and make an announcement that is meaningful in the context of what the IFS has just said. I mean, that's a huge amount of money to try and raise. And I agree with them. The Labour Party position, which one of your guests articulated earlier, which is to tax companies to try and raise that, is just not going to be. Corporation tax isn't big enough. It has to be something like income tax, VAT. It will have to come from people. And that's a really, really big political challenge and risk for the government to start popping up talking about in the middle of a period when it's divided on Brexit.
If people are going to be asked to pay more for the NHS, they'll want to know that their money is going in the right places. After the 2014 review, a huge amount of money was promised in efficiency savings, 22 billion in efficiency savings as the government gave 8 billion in additional funding. What progress has been made on that?
There's definitely progress. I mean, the NHS currently is more productive than it's ever been, and the Institute for Fiscal Studies report, which we've been talking about, had a historical map of that, actually, and the the forecasting that they've done to calculate this big scary number actually relies on improved productivity even further. So, you know, if the NHS doesn't get more efficient and more productive, that black hole that they talked about is going to get even bigger. But, you know, the good news is actually the NHS is probably the biggest uptaker, if that's a word, of new technology and innovation, you know, across the public sector. So it definitely can get more efficient. It must, if we do put more money in, it mustn't just go on wages, which I know there will be the trade union position.
Sarah Wollaston, is it fair to ask the NHS to keep making these efficiency savings all the time?
Well, as Sean has pointed out, the NHS productivity is outstripping the background economy, so they're doing very well. Of course, there's always more to do, and particularly in the way the NHS uses digital technology. Anyone who's in the NHS will recognise the frustrations of one hospital department not being able to read another's results from another hospital, or the inability of patients to control their own record and share them across different systems. So we need to make progress particularly on our use of IT.
And Sarah Wollaston, can I ask you, because several of your colleagues, other Tory MPs, have been making statements this morning about abortion rules in Northern Ireland in the wake of the referendum result in the Republic yesterday, calling for the rules to be changed, saying that Northern Ireland can't continue to have the strictest abortion rules just about in the world. What's your view on that?
Well, my view is that it's not right that women in Northern Ireland can't be able to access the same rights as women in the rest of the United Kingdom. And if an amendment is allowed by the Speaker during the domestic violence bill that's coming to Parliament that puts that right, I will be supporting it. However, I'm very mindful of what Rory Stewart was saying earlier about the fact is that this is a devolved issue and that might not be allowed. Of course, we'd all like to see the Stormont Assembly back up and running, and for this decision to be made by people in Northern Ireland. But if that doesn't happen, and if the Speaker doesn't allow an amendment whilst to the forthcoming legislation, then I think at the very least people in Northern Ireland should be allowed a referendum so that we can gauge the strength of the opinion there. And actually I think that would help to make the case that the current situation is clearly unacceptable.
The Prime Minister hasn't said anything about this yet, and of course there is a suspicion it's because she's in coalition with the DUP, who would be absolutely against any changes to the law in Northern Ireland. Do you think the Prime Minister is hampered on this by the coalition she's entered?
No, because of course these are always issues that are a free vote in any case. I think that the key issue here is whether or not an amendment would be allowed by the Speaker, given that this is a devolved issue. So undoubtedly an amendment will be tabled. I will be working across party lines, because I don't think this should divide on party lines, with MPs from across the House to try and bring forward an amendment, but it will be up to the Speaker whether or not that amendment is allowed, given that this is a devolved issue. But I think, as I say, what we should be doing is looking at this from the perspective of women in Northern Ireland, who are now going to be in a position where everywhere else, both in the Republic of Ireland and everywhere else in the United Kingdom, women have greater rights than they have, and that can't be right.
Sarah Wollaston, thanks very much. And Sean Worth, before we let you go, we'll just come back to the health spending issue. Are you confident? I mean, you said there are significant problems with the way the government may choose to fund this, political dangers there. Are you confident, though, that a funding settlement will be found that will satisfy the NHS?
No, I'm not. And I mean, Sarah's done a manful job trying to get cross-party agreement on what we should do next, and notably absent from that is the Labour leadership. You know, why would they want to get involved in helping the government deal with the pressure that they're facing? They want to pour petrol on that because they want to exit so that they can take over, which is exactly the right position to take. You know, I think they shouldn't jump up before the birthday and try and do something big, because, you know, as you imply, the rest of the kind of health lobby, if you like, will always say this is not enough. What they can do is make a decent gesture, and then open up a debate, probably for after Brexit, to be honest, you know, politically, and deal with issues like social care, which is just a massive problem now. But you know, I don't think they can make a dent in the current issue within the current political parameters they're in.
All right. Well, Sean Worth and Sarah Wollaston, thank you very much for talking to us this morning.